I'm Edward Warfield, the publisher of City Biz, and I'm honored today to interview Dr. Adam Waldman, who is a partner at Cardiovascular Center of Florida. Welcome, Adam.
Thank you, Edwin. I appreciate the invitation and the opportunity to come and meet with you today.
In January of 2024, Cardiovascular Center of Florida was formed. How has the last year been during this change?
Well, that's a great question, and I should ask you, how much time do you have? We could go on quite a bit about that one. So to give a little history, and we started this practice in October 2023, so we're 16 months into this. We're still in our infancy. There are currently 30 cardiologists in my group, and at the time, 27 of us were employed by Orlando Health, which we had been for many years. The majority of those came from two private practice groups that merged with the hospital over the years, and in the first few years, everything was really good. We had a very symbiotic relationship with the hospital. Patients benefited, we benefited, the institution benefited. However, over time, things changed. And we, over the past few years, had looked at some other options and decided that we and our patients would best be served going back to the private practice of cardiology. So the past year, or the past 16 months since we've done this has been some of the most challenging. I'm not going to lie to you. It's been exceedingly challenging to start a practice from scratch. However, it's also been exceedingly rewarding. So there's pros and cons about everything in life. But like I said, it's been exceedingly challenging, but the rewards, which are really starting to grow, and you can really see it. I think I feel it most when I see the patients and the amount of time I get to spend with them. And when they leave the office and they go, wow, it's different. I can feel a difference. They feel a difference when they come in, from our staff, from the smiles on everybody's face. They don't feel like it's so corporatized, if that's a proper word to use.
And so why did you join the Cardiovascular Center of Florida?
So another great question, and let me correct it. We didn't join. We started it. We started it from the ground up, which is something vastly different than everyone else in this community has done for many years. The old group that I joined in 2006, the Orlando Heart Center, was actually founded by Dr. Jonathan Partain in 1968. So since that time, no one's really founded a group. Everyone has kind of joined on in different iterations of that group and the other group, Mid-Florida Cardiology, that was in town. So none of us actually started a practice of all the current doctors. We had all kind of joined a group that had buildings, that had staff, that had computers, that had insurance products, that had an infrastructure. We were kind of plug and play. This was completely different, and no group this size has left hospital employment to return to private practice anywhere in the country, still to this day, as far as I know. So when you think about what we had to do in 90 days, which was our time when we gave our notice to when we opened doors, we had to get offices to see patients. We had to get staff to help us see patients. We had to get computer systems and electronic health records. We had to get radiology systems for our echoes and our stress tests. We didn't have a pen or a pencil to our name before we started. We had to get administrators. And while we were doing this, during those 90 days, keep in mind, we were still practicing cardiology, seeing patients in our prior job. So it was an enormous undertaking that we begun back then.
So can you give us an introduction to where cardiovascular is today? How many practitioners? Give us a snapshot of where it is today.
Sure, I'd love to. Over the past 16 months, we have evolved and we continue to grow. Currently, we're 30 cardiologists, 30 board-certified cardiologists throughout the Central Florida region. We practice currently out of 11 offices. We offer all cardiovascular full services short of cardiac transplantation, which we partnered with several other institutions in the Central Florida area who bring expertise to that table. But we provide full cardiac service, high blood pressure, palpitation, syncope, which is a pass-out spell, heart disease, heart attacks, structural heart disease, which is one of the more interesting and fast-growing fields in cardiology. A big focus of my practice over the past year has been preventive cardiology, because with this transition back to private practice, I've had more face-to-face time with the patients that I can talk about nutrition, I can talk about exercise, and preventing problems. One of our goals in one of the changes in society and cardiology and medicine in general is it's turning into more of an outpatient world. patients don't need to go to the hospital for a lot of things. Bad things happen in the hospital. It's not good for the patients, it's not good for the families, and it's not good for the overall healthcare system when you look at the financial problems that cardiology in particular bestows upon it. There are times when you need to go to the hospital when you're that sick, but a vast majority of procedures, for example, we're going to open up a surgical center later this year. We'll be able to do stents, pacemakers, defibrillators in the office. This is a game changer from the previous world when you went to the hospital. The hospital staff may or may not have taken great care of you in the beginning. You may have gotten bumped all day for emergency cases, and they may keep you overnight. And the cost to the system is outrageous when you do things inpatient versus outpatient. Patients will come into our nice, comfortable, hospitality-focused office. They'll get their procedure. There are no emergency bumps because it's all scheduled procedures. The cost to the patient and the system is a fraction of the cost. So it's a win-win for everyone. For us, it makes it much more convenient because I can go from here down the hall and do your heart catheterization. Well, not in this office, but in our future office that we're building and opening up shortly.
So what is the footprint today of your firm?
So today, like I said, we started in 11 offices all over the geographic, the 4-county area in Central Florida, and we're actually expanding hospital coverage-wide to other places where we previously haven't covered, as far north, as far away as Lake Monroe. I'm not sure if Lake Monroe is north. I'm going to take that back. As far away as Lake Monroe with the HCA facility over there. But our 11 offices cover anywhere from Claremont all the way there. We go to Lake Mary. We have presence downtown, Dr. Phillips, Ocoee, East Orlando. And we have 3 buildings we're working on currently. Right now, our first new office, you have to think about it. Those 90 days, we had to just find offices. We didn't have optimal time. We couldn't build anything in that time. We had to kind of take what we could get, and the real estate market wasn't very friendly to us at the time, if you recall. So currently, Lake Nona will be our flagship office, which will open up, and we'll start seeing patients there this April. And that other half of that building, that office floor that we have, will be our ambulatory surgical center, which should hopefully open up and start doing procedures in the fall or winter at the latest. And when I say Lake Nona, when you look at the medical city up there and the growth and the university and the opportunities that are there, it's limitless up there. And we think the future of cardiology in Orlando is based out of Lake Nona. And we're working with HCA and UCF to build an amazing program up there. We're actually going to start building a whole new cardiac surgery program throughout Central Florida with the return of one of Orlando's most preeminent cardiac surgeons, Dr. Stephen Hoff, who's coming back to start in the next week or two with us. And we're really excited about that for the future, for all the patients and the benefits that'll bring. Our next building, where the walls are already up on the outside, will be in the Dr. Phillips area, which will allow us to consolidate 2 smaller offices into one that we've been able to design from the ground up. And following that one, we have land, and we're going through the permitting process in Claremont, which everyone knows has grown like crazy over the years. And we'll have a big office there with another surgical center in that area to serve the patients on that side of town.
So what differentiates Cardiovascular Center of Florida for some of your competitors? I think you touched a little bit on that in terms of your thought process, but could you drill a little deeper into that?
So I look at that in a few ways. Number one, I don't worry about my competition. I don't worry about competition. I worry about what we can control, what I can control. And I think that's a good lesson for a lot of things in life. Don't worry about what others are doing. Worry about what you can do. So I think that we separate ourselves several reasons. And I think it depends which cardiologist you look at as to what the differentiating factors are. Number one, when you compare us to the hospital, it's completely different. When you look at the cost structure that we mentioned before, patients come here, their copay is less, the insurance pays are less, so it's better for the patient, it's better for the insurance company, it's better for the overall healthcare system to save those dollars. When you go to the hospital, it's also much more corporatized. Again, using that word that I just made up. It doesn't get the feel of you're being in a doctor's office. You don't get that feel. You kind of, towards the end, when we were pressured to see so many patients in such little time, patients told me at times that they felt like cattle kind of just being herded through. They got put in, they couldn't get a parking, they couldn't get this, they couldn't get anyone on the phone. And when they got there, a lot of times in hospital medicine, you don't even see the cardiologist anymore. You may be seeing some other advanced providers. And don't get me wrong, these advanced providers have tremendous need. We have tremendous needs for them in healthcare, but the amount that they were being relied on in the hospital, some patients were becoming quite upset with that. In our new world over here, every patient I see gets face-to-face time with me. It's longer. It's not as rushed. I don't feel like there's someone outside the door with an hourglass who's going to come banging on the door or yell at me afterwards. I can spend as much time with each patient as I want. Like I said, I'm doing more preventive cardiology over the past 16 months than I did in the past 16 years, probably, mainly because I have the time to give that kind of stuff. It's not just come in, let me throw a pill at you, let me order a test. It's, hey, tell me what you're eating. Tell me what you're exercising. And all my patients know that I talk about exercise and what they're doing physical activity-wise at each and every visit, which is something new. So there are some significant differentiators from the hospital outpatient that we just mentioned. When you talk about other private cardiology groups in town, first of all, there's not that many. Over the years, there's been a huge transition where when I was in training, for example, 90% of cardiologists were in private practice. About 10% were employed either in the VA system or in academic medicine. Very few were full-time employed by private hospitals or community-based hospitals. That pendulum swung quite dramatically to about 90-10, the opposite way over the years. And now, because of what they're realizing it wasn't such a great move, is the pendulum is starting to shift back to more private practice. So there are some private practice doctors in the community. There's some very good groups. There are some sister groups we have, and the equity group that we join does have sister groups all over, and that's one of the benefits, that we can get things cheaper. It's almost like buying in bulk at Sam's Club, or how Walmart gets things for so much cheaper than their competitors. For example, if you look at loop recorders, which is a small device placed inside your chest to monitor for any heart rhythm abnormality, we have a nationwide discount on ours that makes the cost savings go on to the patient, the insurers, and the system. And it's coming out of the pockets of these companies that are making billions of dollars. They're still selling them to the hospital, who charges an arm and a leg more than we charge, and it's so much more beneficial for the patients and the system. Some of these other groups also in town, although they're great cardiologists and take great care of people, they're not 30 cardiologists. They don't have the breadth that we have here. They don't have all the full service that we have. It's just the quality of doctors we have. When you look at, Orlando puts out that Top Doctor and Best Doctor magazine every holiday season. We have more, I think, than anybody else in there, and we're only open for 16 months, remember. So it's quite an accomplishment, our skill level and the variety of illnesses that we can deal with.
So do you want to share some of the highlights from your career?
Sure, I'd love to. Thank you. So, there's a lot of memories I have starting from medical school, learning about some of these things from the very basic science stuff that I think back sometimes and I can't believe how far I've come in my career. I remember when I graduated fellowship when I was over in Tampa, and my older son, who was 2 at the time, during the ceremony just decided to kind of run up on stage with me when I was getting my diploma. But I think when you think about great stories about patients, one in particular comes to mind. And it's interesting because I'm a cardiologist and that's what I do, but it was more of being a physician that made this case stick in my mind. And I'll go back to, I think it was 2012 or 2013. And I had this patient, he was in his mid-80s at the time, and I had been very close with his family. I knew his family for many years. He had a stent placed with us by one of my partners years before that. And in 2012 or 2013, he was found to have a lung mass. The family called me in a panic. I helped get him in for expedited to get a biopsy. Turned out to be a lymphoma. I expedited helping him get cared through a great hematology oncology doctor here, Dr. Jose Serriero, who's a wonderful physician who I've known for many years. He saw him and said, let's start treating him. Now, a lot of people would say he's 86, he's in his mid-80s. What are we going to get out of this? Well, anyway, he said, let's treat him he gave him a less severe or less toxic course of treatment and said, let's see how he does. Well, he started to respond to it. However, right over Christmas, his cells, I don't want to get too technical here, but he got very sick. He got septic, admitted to the intensive care unit with a severe infection, and put on a ventilator. And it was either Christmas Eve or Christmas Day, I got a call from the family who said they want to turn off life support on, my dad, it was a husband, it was a huge family here in town. They said, what do we do? I said, I was on vacation, but I said, I'm on my way. Threw on some clothes, came to the hospital, talked to the family, talked to the critical care team. And then I realized that, wait a minute, part of the problem with medicine over the years and hospital medicine is it's fragmented. None of those doctors knew him. None of them had ever known that he was a proud military veteran who served many years, that he was an educator here in town who had taught patients of mine actually before and been the principal at schools where they went. None of them knew that this guy in his mid-80s was still riding his tractor and taking out a sailboat on his own. I knew that because I had seen him in the office. I had a relationship with him. So I spoke to the family. They had to be realistic. But I also said, if anyone's going to fight back from this, it's him. I know him. And they said, we want to give him the chance. I spoke to the critical care team. I explained to them about him. And you know what I said? Give him the chance. Be aggressive. Don't just pull back care. Don't give him a chance. Give him more antibiotics. Give him more time on the ventilator. Lo and behold, he walked out of the hospital. He lived for about another 10 years after that. Think about that next 10 years. Sorry, I get a little emotional. Think about those next 10 years. He saw more grandkids being born, more great grandkids being born, more family weddings, more holidays he got to spend with his family. And it's because a doctor knew his patient. You take out the corporate stuff, you take out the siloing when your doctor doesn't know what's going on. And when you go to the hospital, it can be scary because a lot of the doctors you may have never met before. And if you're really sick, that's a really scary time to meet someone for the first time. So this is, this really sums up why I think a lot of my partners went to medical school and did the training we did. So we could actually make a difference in patients' lives when it really, really mattered. And I think that case, although it's not a cardiology case, for example, really brings a good example of why we went into this field.
So Cardiovascular Center of Florida is at the forefront of cardiovascular care and is a new way to look at healthcare. Can you share some insights on how you are approaching healthcare?
Sure. So we look at the future and we look at, people talk about AI, people talk about genetic medicine. Cardiology, when you look at medicine, has advanced so much in the years. And when you look at the past, I'd say 10 years, we can talk about things like the medications that we use, whether it's blood thinners or heart failure medications. We can talk about the structural heart program. People with severe valve problems in their 80s and 90s, we didn't have treatments for them before that weren't high risk. Some of them just ended up passing from their disease. Now these people are getting procedures through their groin or other options where they can live another 10 or 15 years. And it's important that we make sure that we don't want to just live. We don't want to extend someone's lifespan if they're not healthy. We want to expand their health span is a better term, I think. So we need to be more, the word is, I would use patient-centric. And we have that in our mission statement. We want to provide patient-centric care to each and every patient as well as their families. And we want to do that in a cost-effective way. We want to do it in an efficient way. We want to take a lot of the BS, so to speak, a lot of the bureaucracy out of healthcare. It's stressful enough when you have a heart attack and you need to start following with a cardiologist. If we can make that stress a little less by streamlining things, I think it's great. When we talk about, we've actually started a hospitality committee. Who thinks about hospitality in healthcare? Well, healthcare is way behind the 8 ball, and we're fortunate enough to have Dr. Abe Pazam, who founded the Rosen College of Hospitality, helping us launch this hospitality and healthcare program. We're doing surveys with patients. We're changing artwork. There are little things you can do that make patients much more comfortable during an otherwise stressful situation. There's no reason that can't be done. And we're really pushing that to the edge here at the Cardiovascular Center of Florida.
And so what are some of your major priorities as a partner?
So we want to grow. We want to open these new offices and make it a better location, physical location for these patients. We want to make it more hospitable, more convenient. We want to improve parking. We've gotten busy pretty quick at some of these offices, and the parking isn't great. So we want to improve those things. But each one of those steps we want to improve and make it a better world for all of our patients going forward. When we talk about priorities, I want to make sure our staff is well taken care of. The better they're taken care of, the better they're going to take care of our patients. We are all in this together. Our staff should be treated like they were our customers, so to speak, some would argue. And then I want to make sure we're taking care of the physicians. One of the problems at the hospital is physician wellness was suffering tremendously due to the pressures we were facing. And physician wellness, I'm sure you've heard about physician burnout. We really need to focus on physician wellness. We need to focus on staff wellness. And we do all that so we can take care of ourselves, so we can take care of our families, which include our patients, our staff, and everyone we work with. So those are some of the priorities. One of the other ones, which is interesting, is training the future generation of cardiologists for years to come. And we're partnering with the University of Central Florida and the HCA hospital system in launching their first cardiovascular disease fellowship, which will hopefully get started July 1st. Fingers crossed. We still have a few hurdles to go through, but so far we're moving along the regulatory issues pretty quickly with the help of UCF and HCA.
So what is your vision for the company and for the industry?
So I think starting with the industry, we all need to get better. We all need to focus on the patients. The reimbursement system in healthcare is not optimal. We all know that. We're not going to solve those here today, but what we can start with is solving and taking care of one patient at a time, each of us doing our part in this process. In the future, I want to see our practice grow. I want to see it evolve into the future. I can't wait to open up new offices. I can't wait to expand. Like I said, we've been open for 16 months, and our prior group started in 1968. The other one, I think it was 71. I want to evolve into the future of cardiology here in Orlando. This is a legacy-building opportunity we were provided with the help of CVA USA and our partners. We're building a legacy. None of us have ever done anything like this professionally. We take care of patients. We do that every day. But here we are actually building a legacy that'll hopefully stand in the Central Florida area and last long when we're retired and when we're gone. And I hope that we can make a difference in patients' lives, our staff's lives, and the community all around us for a long time.
Well, Adam, I want to thank you for sharing your story as someone who's spent a number of visits in the ICU unit based on my cardio issues. A lot of your remarks were resonating with me. So again, thank you for your time and continue the great work that you're doing, and keep us apprised of any as you expand and beyond your wildest dreams.
I want to thank you for inviting me and the opportunity today. I want to let people in the Central Florida area know that we're glad to see patients. We're seeing patients in our 11 offices. You can go to cardiovascularcenter.com. You can go to mycvcfl.com, or you can call us at 407-738-4200. And we look forward to taking care of you on your journey to a long-standing health span. Thank you again.